First Five Santa Clara County serves our children and families in three major areas: as a funder, as a resource, and as an advocate. As a funder, First Five provides programs and services to children focused on their physical and behavioral health, high-quality early learning, and supports for their families, all focused to provide a loving and nurturing home for our youngest citizens. As a resource, First Five provides the latest innovative professional development opportunities and research for families, for leaders in this community, for teachers, and for service providers. Most importantly, focused on policy level issues and practices that positively impact the lives of our children. As an advocate, First Five is constantly keeping the focus of our youngest children at the forefront for policymakers and for community leaders, all aimed at sustainable policy and system changes that benefit children, not just our kids for today, but for generations to come. We advocate for more public and private resources where early learning takes place, where families are supported, and where children are healthy. And we can also ensure our elected officials and business leaders in our community place the well-being of children as their top priority. Most importantly, we can celebrate together the success of our youngest children, because when they thrive, we thrive, and everyone is welcome to join this movement. The second most important aspect to maintaining our strategic direction is by continuously forging strong partnerships. Partnerships that are based on trust and relationships. Partnerships that are focused on common outcomes for children in our community. Those partnerships are the vehicle by which the strategic plan gets carried out. It's not First Five's mission, our staff, our internal staff, to carry out our strategic plan, but rather through partnerships in community.
First Five has had an enormous impact in the community here in San Jose and Santa Clara County. I can't imagine where we would be in what we're trying to achieve without First Five. We're finding that educational achievement is much higher now in the middle schools and in high schools than it's ever been. And we're really very proud of the fact that really for the first time we're seeing childhood obesity rates actually dropping, where for many years it was increasing. So we just sort of see all of the programs that are involved with First Five are really paying off. Certainly when it comes to early education, making sure kids are prepared for kindergarten and for elementary school. When it comes to nutrition and physical health, we're finding that kids don't have the medical issues that they had in the past. And then the last part too is the support that we're giving to families. It's never easy for anyone to raise a child, but if you're new to this country or if you don't have the means to provide all the support that are necessary, First Five is there to help the family, to give them the information and the resources to make sure that the family unit as a whole can prosper.
Since its inception, First Five has impacted tens of thousands of lives of children, birth through age 5, and supported tens of thousands of families who parent those children as their first teachers. It is really important to know that the impact that we've created in this community has been raising that flag about the importance of the first 5 years of life and assisting parents and caregivers through access to information, resources, and services that they in turn can impart to the children of this community for generations to come. First Five Santa Clara County has been able to sustain impact over the last 15 years by focusing on our strategic plan and never wavering from that direction. That direction was provided for us by the community. And one of the ways that we do this is through rigorous professional development. Taking our service providers, our policy leaders, our families, and really focusing in on professional development, training opportunities, information access, all aimed at the latest research and evidence-based practices that impact the lives of the children in our community. By staying focused on our strategic plan, creating a workforce that is strong in the activities and programs and services that impact our children, we will achieve our goals and objectives. Thus, we will achieve our vision and our mission.
I think having First Five in our community, particularly here in Santa Clara County, has been great as far as linking family, health, and education. There are so many different systems here in Santa Clara County and in California, whether they're schools, whether they're hospitals, whether they're government entities. And having an entity like First 5 that can really bring partners together to improve the lives of children and families, particularly children in poverty, has just been incredible. We're fortunate to have great leadership here in Santa Clara County. And again, bringing those partners together to link education, health, family wellness, teacher professional development, and high quality service has really been a great benefit to our community.
Everyone is responsible for the well-being of our youngest children. Everyone. How do we do that? Simply by reading, singing, playing, and talking to our youngest children, and providing nurturing environments where children can grow and thrive and be healthy and reach their full potential, inclusive of every child and also supporting every family. Every one of us can advocate for more public and private resources that ensure the healthy development of our youngest children, and also by ensuring our political leaders, our elected officials, our business folks really understand the needs of children and support for their families and place those needs and that support as their highest priority. Everyone can be involved. Everyone needs to celebrate the children's successes in our community, and everyone needs to understand they are our most important resource.